We'll start this video by reviewing the two quiz cases from the end of the prior video. And the first quiz case was regarding this image, and the question was, what is the sign and what is the syndrome? And the pertinent information I gave before was that this is a patient with a shunt. So the name of this sign is the snowman sign, and some of these signs you have to have a decent imagination for, but here's an example. With the cartoon overlay, you can see the snowman and how it sort of resembles that. And this is indicative of a supracardiac total anomalous pulmonary venous return. Usually the pulmonary veins here, 1, 2, 3, 4, drain into the left atrium after the blood in them gets oxygenated in the lungs. But in this case, instead of returning to the left atrium, they travel back into the superior vena cava. And that's why you have this enlarged mediastinal contour. Our second case, we saw this radiograph and this radiograph, and the question was the same. What is the name of the sign and what is the syndrome? So the finding here is this opacity here, and this opacity similarly here, and this is known as the scimitar sign. Again, some imagination here. It sort of has that curvature and looks like a scimitar sword, and you see this this is pathognomonic in scimitar syndrome, which is also known as hypogenetic lung syndrome, and this is just a cartoon representation. You can see this large pulmonary vein. Instead of returning to the heart, it returns to the inferior vena cava. We'll move on to our cases, and we're covering Cecal and Sigmoid volvulus today. So here's another cartoon. We have here the proximal colon, or the cecum, and as we go distally into the transverse colon and descending colon, this is the sigmoid colon with the rectum over here. And what this cartoon is showing is that you have these loops of sigmoid that can twist on themselves, resulting in obstruction and vascular compromise. While this is, a sort of a textbook example of what the large bowel looks like, in a lot of patients they tend to have redundant loops of large bowel. So instead of going straight across, sometimes they can have it come up here and come down and come here, and then the descending colon can come down, and the sigmoid colon can go a little bit up here and a little bit in other places. Each patient is unique. This is typically what it's like, but sometimes they can have more redundant loops of bowel. So we'll move on to our first case image, and we see here a very dilated loop of bowel. And important to note is that we have this line over here showing that the bowel is pointing towards the left lower quadrant. It's pointing towards over here. This is known as the coffee bean sign, and this is characteristic of a sigmoid volvulus. We have our CT exam here, and we'll just take a quick scroll through the entire exam. We can obviously see that there are some pretty dilated loops of bowel. Okay, and looks like large bowel, so we'll just start off. I'll just draw your attention to the large bowel here, and so here we have the rectum, and we're coming up and up and up, and here the sigmoid colon, we start to have some twisting, some swirling, and you can see here it is, and here it is, and you can see this abrupt transition point from collapsed to dilated large bowel. And we're going to follow this up and up and up and up, and still dilated and back down, and we're here now, and now we're starting to come to a normal caliber. Still going, and we're going to see here it is again. Now it's collapsed, and this little strand of tissue here is the large bowel, and it's coming across. It's a little hard to follow, but you can see that there's an abrupt change from dilated bowel to collapsed large bowel with some swirling here. And swirling, sometimes one plane shows it very well compared to the other. Again, here just so you can see this dilated large bowel, and it sort of points towards the left lower quadrant, which is another factor that raises suspicion that it's sigmoid instead of some other location for the volvulus. And then you can see here that swirling again, indicative of volvulus. So this is an example of a sigmoid volvulus. So now we'll move on to our cases of Sickle Volvulus, and here again you can see some dilated bowel. This is large bowel, and you know that because you don't have the thin lines going across the entire bowel loop, which would be a valvulae coniventes, which you see in small bowel. Here you have the haustral markings, which do not span the entire bowel. Now this is dilated, and if you take a look at it, the bowel loop is pointing somewhat towards, it's pointing towards the right, whereas a sigmoid volvulus tends to point towards the left. So that's your first clue that this is a Sickle Volvulus. Another clue would be if you saw normal gas within the sigmoid colon. We'll go to our CT, and again we can see this very dilated cecum, and we can follow it along here. Now we see here it's dilated and it's tapering down, and here is a transition point, an abrupt transition point where now the bowel is collapsed. Okay, and then we'll follow to the other side, and we can see here, again, very dilated, and now tapering down very rapidly. Here it is. Again, abrupt caliber transition point here, and we can see it coming over here. And if we take a look at the coronal view, again we can see this swirling of bowel and mesentery, which is diagnostic of volvulus, and in this case, Sickle Volvulus. One more case. This is another case of Sickle Volvulus, and what I want to draw your attention to is this abnormal distribution of bowel air, specifically this air over here. This is normal layering of air. The patient is lying down, so the air is going to come upwards. This is abnormal. This is air within the bowel wall, and that's indicative of a vascular compromise, and this patient is likely heading towards a bowel rupture if they don't get immediate surgery. So those are our cases of volvulus. We'll move on to our quiz cases, and this is the first case. So this is a non-contrast enhanced CT exam of the thorax. The finding is a little subtle here, but if you see it, let me know what you think the diagnosis is. Move on to our second case. This is a T1 contrast enhanced sagittal MRI of the brain. And again, if you know what the diagnosis is, then leave it in the comments. And our third case, an X-ray of the knee, and there is a finding here, and let me know what your differential diagnosis is. That's the end of this video. If you liked it, then give it a thumbs up, and if you want to see more, then subscribe to the channel. Thank you.